A very good morning. Very good morning. I hope that you're doing well wherever it is that you are. My friend Ayub Oyeyo has been with you here, of course, doing politics. Today is Wednesday, and every Wednesday we like to talk about matters, health, and lifestyle. And today it is something that people have been requesting for us to talk about again. It's about your kidney health and the nutrition in regards to your kidney. Very vital, important organ. I think even that's where we'll start. And to help us with that conversation, I will allow my brother here to introduce himself.
Good morning, Willis.
Good morning. How are you?
How have you been?
I'm very happy New Year.
Nice. Okay. And I'm happy you've reduced weight.
Thank you very much.
Congratulations.
Thank you, sir.
Doing good nutritionally.
Yes.
Yes. So I'm happy, and I hope to our viewers they'll get to learn more.
Yes.
As we finish this session.
Yes, sir. Yes, sir. So Mr. Felix here will help us dissect this issue of the kidney. Maybe first, let's begin with Figo, kidney. What is its importance, Kwamil?
Okay, the kidney is an organ within the body, and the main work is just to filtrate the blood by removal of toxins. Remember, our body intake nutrients. And a part of the nutrients and other things, the body also have its own waste. And the waste of the body is removed through either your sweat, among other areas, your lungs, through your mucus. But also the kidney now filtrate the blood. It filters the blood against the waste. But apart from that, it also helps in also, apart from filtration alone, it also balances your fluid through different electrolytes that the body has.
Right.
And apart from that, it also tends to, once it's filtering the blood, also some nutrients are taken back into the body. But with the main purpose is just to filtrate the blood so that remove any unwanted toxins that might be there among other functions that are there.
All right. So as it does that function, therefore it's very important. Most people have also gotten transplants and all this.
Yes.
You can function with only one. Right. So for you to get a transplant, you have to, of course, be viable.
Yes.
Or it's just anybody can give you a transplant?
A transplant depends with the stage of where your kidney is.
Okay.
And that's why we have different issues to do with your kidney. We can have acute kidney injury or an acute phase, which is it's a sudden, within a sudden phase of kidney injury, okay? While we have chronic, whereby it's gradual. Over a long time, the kidney get worsened or get affected in a way. So this depends with the stage where you are. So for you to enable to be done a transplant, maybe your doctor might check your kidneys. There are different measures that are taken to check your kidney. There can be imaging where the doctor take an image of your kidney to see the level at which the kidney injury is. There can also be a biopsy whereby the part of the kidney can be taken to see how much it's affected. There is also, we have they can check the urea and nitrogen levels within your kidneys, how they are. They can check on something called glomerular filtrations, how your kidney is able to filtrate, and that check on the ranges where they are. So if the filtration rate is above 60 and we say you are normal, but if it's below 60 levels, then it's was badly off. And where it goes about 15 and 20, the doctor can determine whether to do a transplant or not, or whether you should go for dialysis or not. So the test will really determine the level at which your kidney is injured, the stage where you are you at acute phase? Are you at a chronic phase where it's gradual, or are you at end stage kidney disease whereby it's as almost the last stages of your kidney? So that will determine whether you need a transplant or not. Yes.
So then, of course, by the time we are going to the transplant, that is, like you said, towards the extreme.
Yes.
Now you're in dire need.
Yes.
But what symptoms should somebody look out for to kind of know that the problem is probably the kidney?
Now, the problem with the kidney can be caused by several issues that can be there. We can have presenting medical conditions that one can have that can overwork the kidney itself, similar to those with diabetes. You see, when you have diabetes, if it is uncontrolled for a long time, you can have kidney issues because the sugars tend to irritate or inflammate the filters of the kidneys in a simple way. So when the filter of the kidneys, the arteries or the nerves or the glomerulators or all that are inflamed, they fail to filter. And this will lead to a lot of waste remaining in your body, and this can harm your kidney and your body more. Things like diabetes due to sugar. Hypertension can also be there. And apart from hypertension, we can also have other factors such as cancers of the kidneys and so on. And at that point, someone can have symptoms at those stages. And the symptoms can either be when the kidney is not able to filtrate well, then the levels of the waste within your blood will be high. So this waste can be in form of urea. This waste can be in form of creatinine or urea. These are waste of the body. Like creatinine now, when the body is breaking too much muscles, right, and the kidney is not able to control the normal levels that should go out and those that should remain in the body. There is a protein known as albumin, which also helps in your immune system and all that in your body. Mm-hmm. Normally, the kidney control it. But when there are levels that start leaking through your urine that can be shown, like now once the doctor also want to determine if your kidneys are functioning, they can also order a urine test whereby they'll check all the protein leakage, which is the albumin. Mm. So if the albumin levels in your urine, that can be done either by a nitrourine dipstick test, whereby you take your urine, then there is like a stick, like the one they check for pregnancy and all that. Right. So they also dip inside the urine. So if the color changes to determine there is presence of albumin, it shows your kidneys are not able to function well because we should not have a protein breakdown in our urine. Apart from that, there can be swellings, either swellings on the arms or on the legs or around the eyes, something we call edema, whereby the fluid accumulation within your body is too much that the kidney can't control, because the kidney also controls your fluids, and this is through the electrolyte that the body has. So apart from that, they can check your blood now. They can do urea, electrolyte, and creatinine levels so that they check how the kidney is able to balance these electrolytes, how are these waste in form of urea, creatinine, and all that. So this will signal you having a kidney condition or that, among others. There are intoxications. You've taken a chemical that is overworking your kidneys. There are kidney infections that can also come there. There are things like kidney stones. I hope you've heard of kidney stones. Yes. Where some salt, calcium, fat pile up together in your body and forms a stone on your kidneys. So these stones tend to block the filters of the kidneys. And when the filters are blocked, the kidney gets more injured. There's more inflammation there. So the doctor will determine that depending on the symptoms you have. There can be that swelling that we have said, nausea and vomiting can be there, abdominal rumbling can be there, vomiting for some people. We can have anemia or low HB levels for some people, because that can also occur. Poor urination, and this can happen to those who have prostate issues also. Poor urination, or you start seeing different color of your urine, bloody tissues in your urine and all that. Even long-term urinary tract infections can lead to acute kidney injury, and so on. Things like alcohol, things like cigarettes. Most of this lifestyle can also aggregate to kidney issues that can be there. Yes.
So now, I guess for you, is there like one key determinant? Of course, I mean, if you're unfortunately seeing blood in the urine or blood tissues, of course, that one you can visibly see. It's a visible sign. Is there any one thing that, a sort of pain that somebody can feel and say this is a problem with the kidney, or you have to go now you can suspect and then go for the check?
In my opinion, there cannot be one determinant.
Okay.
And that's why you cannot assess your kidneys by your own. And the reason why you can't assess your kidneys on your own, you can't see the kidneys. They're from inside your body. But once you have poor urine output, or you have problem with your urine issues, the different color in your urine, you've started noticing some swelling in your body, either around your eyes or that, then there can be higher chances. Right. Because things like nausea, vomiting, there are so many conditions that can lead to that. And that's why I always tell people, prevention is better than cure. Right. And for prevention, go for normal checkups once a year, so that you can know how your kidneys are functioning and other organs. Do you have diabetes or not? Is your pressure normal? Because your kidneys can also elevate your blood pressure. Vice versa, your blood pressure can affect your kidney. So if you have some of these chronic conditions such as diabetes, hypertension, and so on, it's good to check your kidney over and over when you're being reviewed by your doctor. Right. But for a normal person, go for general body checkup, a Wellman's clinic, check for your general organs, how they are functioning, so that you're able to prevent, because you can't really see it on that manner, because you can also have edema due to other issues that are affecting your body, either your electrolyte levels are imbalanced and so on. So there can't be one determinant, in my opinion.
All right.
Yes.
I want to also invite the people to ask questions if you have questions around kidney health and
diet.
So what questions do you have around kidney health? And this will include nutrition, diet. The hashtag to use is Daybreak. You can SMS us on 22422 as well. That's our SMS platform, 22422. And the hashtag to use is Daybreak. What questions do you have around kidney health, which will include nutrition and your diet as well? So what are some of the different, you've mentioned kidney stones. Mm-hmm. What are some of the other common, let's call them maybe ailments or conditions that affect the kidney?
There's so many of them, right. Willis. There is pyelonephritis, whereby the nephrons, generally those nerves are inflamed. There are, we have acute kidney injury. We have talked of that. We have chronic injury, and I will say there are so many that we can't mention all of them together. Right. And from a doctor perspective, I think when you come with a doctor next time, we will be able to discuss that in length, because there are so many.
Right.
Yes.
What are some of the common ones?
The common ones.
Stones, I hear that.
Yes.
Lot, yes.
The kidney stones are there. The chronic kidney injury is there. End-stage renal disease is there, and so more.
All right.
Because I really don't want to come there
into
the medical part, because it's not really my part. I really wanted to major on part of nutrition and all that.
Yes.
Yes.
So when it comes to nutrition, and now, of course, because there are foods that we are supposed to eat. I don't know whether we tackle it from the foods we are supposed to eat or what we don't eat that will lead to some of the issues.
Okay.
Yeah.
Now, you see, when the kidney has an issue, and we have said one of the most important things is to filtrate the body against the waste, okay? Now, there are components within your body and diet that can worsen your kidney or can also make it to progress better. So we've talked of the causes. They can be medical, they can be lifestyle and all that. But now, how do you manage the kidney depending on the stage, whereby if it's acute stage, they can just give you some medication and fluid rehydration and then clear the waste, like acute kidney injury, just medication, clear the waste, clear what is causing that, and then you can go back to your normal life. Your kidney can go back to normal life. Right. When it's at chronic stage, it depends on the stage again. Either medication, balancing those electrolytes, tending to give you diuretics. If you have diuretics are medication that tend to control the edema or the fluid, if there is too much fluid within your system, to remove them up. Or apart from that, if you have low HB levels due to the kidney, because that can also cause that, the doctor can also give you medication for that. So depending on the presenting condition, you'll be managed. If it is end stage whereby you are not able now to filtrate this waste, the wastes are so high, and then your kidney is not able to function normally, then the doctor can do what? Can order for dialysis, whereby now the dialysis tend to help you clear this waste. Mm-hmm. And some of this, how does nutrition come in? One, when people have kidney issues, one of the levels of the things that can be high is either urea and creatinine. And creatinine is a breakdown of muscles. Mm-hmm. So in this scenario, as a nutritionist, we tend to help this over breakdown of muscles. So we'll check this person is this person able to get enough protein? Mm-hmm. Because for your muscles to break down, your body is either not getting enough energy, so it's getting the energy from the muscle system. Mm-hmm. So are you able to get enough energy? Is your protein intake enough? Mm-hmm. And we have ranges for protein intake for kidney patients, whereby at early stages without dialysis, we can give about 0.8 grams per kg body weight per day. That is roughly calculated by the nutritionist. Mm-hmm. Then let's say you are on dialysis, because the dialysis tend to wash out the nutrients and all that, and there is a lot of breakdown. Right. We can give you a bit higher of the protein, about 1.2 grams of protein, or anything above that, depending on your requirement per your weight. But that is something that we calculate. But now, what in general should kidney people know. One of the dangers are electrolytes. One of them is sodium.
Right.
Sodium is salt, okay? Now the kidney, the salt tend to also control your nerve, muscles and all that, but the kidney tend to control the excess of it in your system, okay? Now, people with kidney disease require low salt diet because too much sodium, like if you put salt in meat, it withdraws water. So it will accumulate too much water within your blood or to your kidneys that will overwork the kidneys by pooling much fluid. And that's why sometimes you hear people, there is too much fluid in your kidneys, imefura na maji. Or with this issue now, because the kidney also control the fluid, much of the fluid can go back to your heart and affect your heart because the heart pumps blood and fluid is part of blood, so can worsen the heart condition and leading to enlarged heart or different heart conditions. So what are we supposed to do if you have kidney disease? Control your salt or sodium intake. I tell people do not avoid salt completely, okay? When they measure your salt level, they should be about 135 to 150, okay? So when it's above that range, then we can restrict you from salt completely. But if anything within that range, then we just tell you to take low salt. There are also instances where people with kidney disease, their salt levels are lower than normal, the sodium levels. So you can give them salt. So you don't restrict completely, unless you have edema for some duration, but you don't restrict for life. So, and that's why I advise people, use sea salt. If you have chronic kidney disease or you have renal issues, use sea salt, or you have high blood pressure, use sea salt, because the sea salt, the granules are a bit larger than normal. So they go slowly within your system and the sodium portions are less. So we have amount of sodium or salt that these people require per day.
Right.
So the salt that they require per day, a normal person require 5 grams of salt in a day. That is not more than a level teaspoon for yourself in a day. So
this is across the day?
Across the day for anyone normal.
Yeah.
But if you are restricted on salt or sodium, we tend to advise you to take below 2.5 grams. That is a half a level teaspoon. Maybe can be roughly 4 or 5 pinches per meal. Lunch 4 or 5 pinches, just little, but use it when you are cooking food. Not adding, because so that the temperature is readily available for body to break it down. Then avoid salted food such as canned food, okay? Other commercial spices with salt, any other salted food, even groundnuts with salt, crepes with salt, because they can have accumulation of salt in them. Check your salt readings of the products that you're using, the labeling, so that if it's high sodium, then tend to control that, okay?
Right. What about the one people will not want you to talk about today? After when I know you're progressing towards it, but also as you progress around it, remember to talk about alcohol.
Yes, I'll go there. I'll go there when I'm talking about the lifestyle.
Yes.
So when you've come from salt, we have controlled salt and food rich in salt, and we have controlled the levels. There will be not much to lead also on that fluid accumulation or worsen your edema. Then fat also becomes in. Anyone on kidney should have low-fat food, because the fat, like we have said, the kidney stones can form up. The fats can also pile up with other components in the body, calcium, iodine, and all that, to form the stone, and this can block our filtrators more and more, and the kidney will fail to filtrate. And that's why we tell people with kidney issues, it's not a must you just take boiled food like they say, because there are nutrients in food that are called fat-soluble vitamins. They require fat. So if you don't take fat completely, then the absorption will be low, and then your body will be deprived of them. But you can take some oils which are good, that are not have much of cholesterol in it, and normally we advise liquid oil. So liquid oil, go for triple refined oils. And how do you know triple refined oil? Not anything written in the market, no cholesterol is a good oil.
Yeah, that's marketing.
That is much of marketing.
Yeah, no cholesterol,
I think,
free of... or what, unsalted?
Yes, unsalted and all that. So I always say corn oil is good.
Okay.
Sunflower oil is good, and most of this vegetable oil. I think olive is vegetable.
Yes.
Yes, olive oil, but avoid anything solid in nature. This solid bread spread, I don't want to mention a brand. Most of these solid bread spreads.
What about the solid cooking oil?
Yes, solid cooking oil or anything fat in solid in nature is not good because your body will not be burning it faster as it is solid in a normal temperature. It will take a lot of it to burn it, and accumulation can be there to affect your kidneys. And apart from that, apart from fat, and we also have food with high fat, so control much of the animal protein because naturally animal protein has fat. Okay, so control much of the animal protein, but do not avoid completely because your body requires protein again. Because if you avoid completely, your iron levels will go low and most of your immune composition will also be affected. There will be much burning of the muscles. So you require protein, but a level that is low that we can always discuss when you're making your diet. If it's like a fish, like let's say around 100 grams or 120 grams of protein, let's say 120 grams of fish, 120 grams of chicken, meaning roughly 1 or 2 drumsticks, a palm-sized fish. Why do we tell people with kidneys tend to avoid red meat, okay? One of the wastes is creatinine and urea. So proteins, when they are digested, they form purine, uric acid, urea, or waste in form of the creatinine levels can go higher. So red meat or protein in general, if you take in too much amount, can also lead to more of this waste. And that's why we normally tell any person with kidney issues, avoid red meat completely. You can do more of the white meat because of the buildup of waste in form of urea or creatinine or affecting the nitrogen levels that they also kidney tend to control. So we tell them to avoid red meat completely, take white meat and more of the plant protein. Apart from that, there are also plant protein that can cause a lot of this waste. And this can be in the form of beans, yes, but mostly the red kidney beans that we tell them to avoid because of the high levels of urea and creatinine. But they can do yellow beans, they can do lentils,
yes.
They can do dal or any other white beans is okay. About 1 to 2 to 3 serving spoons, the bigger spoon in their meal whenever they are taking those plant proteins.
Right.
The animal, we say the 100 to 120 grams. That's okay. So we can do animal protein like 2 or 3 times a week, and in between is much of plant protein. I hope we are doing well.
Yes, we are doing
so we control the protein content, and mostly we avoid red meat in the protein. Now, in the protein, we also have things like chicken, which remove the outer skin due to fat component. If it is any
that
other,
is the one people like.
Yes. Remove it because we don't want accumulation over time.
Right.
If it is any meat that is not red meat, let it be lean. People like deep fried fish. So I said if you're not able to get the normal fish fillet, the deep fried fish, make sure you use a good quality of oil in deep frying it. Make sure you strain it, or you can even oven it or grill it. But if you deep fry it with little oil, make sure you immerse it in hot water. The heat of the water will tend to burn out the fat. Fat and water won't mix. That is similar to someone tending to control cholesterol. Right. So the oil will come up. Remove the fish, then prepare now. You can now boil it with tomatoes and all that, okay? Now, apart from the protein, the eggs are also high in fat. So preferably take boiled egg. But because it's high in fat, the other components such as phosphorus, calcium, and all that is also in eggs, do not exceed the limit of at least 1 or 2 boiled eggs per week. But not fried, because when you fry it, you again add up the fat. When you're taking good care of your ill kidneys, when now you have kidney problem. For a normal person, we say not at most 3 eggs, okay? But
per day?
Per day.
Okay. Some
people take daily. Your chances of buildup of cholesterol that can cause different problems to your system. Now, when we come out of the proteins, we also have potassium. Now, this is where most people really confuse. And you'll get a patient with kidneys told to avoid almost everything. And they don't have now what to eat. But I always say, like for me, and also my colleagues at Mater Hospital, we tend to go according to the age of information, according to the presenting science as per the current. We don't really say avoid, but we say moderation because it depends on the levels at what your body wants. So potassium tend to control body fluids, okay? So where do we get potassium? Now, too much of it will overwork the kidney because much of water will be retained in the kidney and it will affect the electrolyte composition or the normal, its work within the body, okay? Because also the kidney control excess of it. Now, how do you control potassium when you have kidney issues?
Right.
One of the things that you should do, avoid anything high in potassium. So what are the normal potassium levels for someone for any individual. The normal potassium level should be about 3.5 millimeters per liter, okay? 3.5 to around 5.5. So when it goes higher than that, then it shows your potassium is high.
Right.
There are also instances where a person can have kidney issues, but potassium levels are low. So what will they be done for? They will be added. So do not restrict completely, but control food iron potassium. Now we have something that is called daily recommended allowance in diet. Now that the ones I've said is in the levels in the blood. So that also from the diet how much you should consume. So that is about 2,500 milligrams to 3,000 milligrams per day. And that's why now we check on the composition of food. And that's why people with the renal issues, they're told to avoid ripe bananas, because ripe bananas tend to have a lot of potassium. Now, one ripe banana has about 490 potassium.
Is this the big or the sweet?
The normal size. The
normal sweet bananas.
Yes, and we have said at least at around 2,500, at 3,000 is at slightly high. Right. So if only one banana will give you 400, that will be too much. So we tell them to avoid ripe banana, okay? The cooked one, despite it has high, it can be removed because potassium is a water-soluble nutrient. And that's why vegetables have potassium, okay? Green leafy vegetables, half a cup, meaning roughly 1 or 2 serving spoons. And people with kidney, we tell them also to take vegetables, okay? And for anyone with lifestyle disease, we tell you to take 1 or 2 serving spoons or about 2 to 3 serving spoons. So almost half a cup or 1 cup. So half a cup of green leafy vegetables have almost 800 milligrams of potassium, okay? And that's why we tell them to avoid things like spinach. For me, that's what I tell my patient. Avoid spinach if you have kidney disease. And why do I avoid spinach? The levels of potassium in spinach and sukuma wiki is so high.
So you'd rather do cabbage?
You can do cabbage. You can do other African greens and other green leafy vegetables, broccoli, cauliflower, carrots, beetroot is a vegetable, and all the rest. But specifically, avoid kales because of high potassium levels. Avoid spinach because of high potassium level. But spinach also have something called oxalates, which are waste in some of these feeds that tend to bind other nutrients like iron being absorbed. That's why I tell them to avoid that. But in most cases, they're given. But if you have to take, then check the amount, not more than 1 or 1.5 serving spoon, so that they're not in exceeding. But to remove the potassium in vegetable, they have to be boiled in a lot of water for 10 minutes or soak them in hot water for 10 minutes. All vegetables for a renal person to leach this potassium out. Okay? Now,
but for a normal person, you require it.
Your kidney can be able to filtrate it. Now, apart from the vegetables, we also have the tubers. The tubers is where we have nduma, we have sweet potato, we have Irish potato. So in most cases, you get most of the nutritionists or doctors tell patients to avoid the arrowroot, avoid sweet potato, avoid Irish potato. And they're the most natural components of food that we have, yes, which also have the vitamins. So according to the research that I've read, the information have come through about kidney management, and then you comprise it to something easier for someone to understand and something they can be able to get. Because you can't tell someone, if you've told me to avoid potatoes, avoid arrowroot, what will I remain with? Some people don't eat bread and all that.
Right.
So you can take this, but the portion really matters. Not more than a fist size of arrowroot, not more than a fist size of sweet potato. But because they have high levels of potassium, what are you supposed to do? Help the potassium leach from it, whereby you will peel the coat. When you peel the coat, the penetration of water become more. So peel the coat, cut them into cubical sizes, and then soak them for 12 hours or overnight. So you can soak your potatoes overnight for 12 hours, soak your arrowroots overnight for 12 hours. Even the matoke. You can take like 2 matoke, you soak it overnight, but take it once a week so that there is no piling up. So once you soak, it will leach this potassium, okay? And so long as it will be in the RDA, that is okay. Apart from arrowroots, do not take beetroot root because it also has potassium. People with renal take it because they believe it helps in adding blood or iron, but it should be soaked. Similarly, do not take raw vegetable salad because they contain a lot of potassium. Do not take vegetable soups because this is where the potassium leaches and will affect your potassium levels, okay? Apart from that, there are other fruits. So one of the fruits that we have said you can avoid is ripe banana.
Ripe banana, yes.
So watermelon is okay, but most nutritionists and doctors tell patients to avoid watermelon. Watermelon doesn't have high potassium. But why do they tell them? It's because the fluid component in watermelon or pawpaw, okay? So how do you deal with it is the quantity. Either half a sliced watermelon, okay, or as 20 shillings Kenya shillings papaya. Papaya has vitamin A, which is also antioxidant, help also as a filtrating system. They also have other nutrients that help to filtrate the kidneys and all that. So cube them into a cup size. That's okay. So you can do pawpaw if you have kidney disease. You can do watermelon is okay. You can do green apple is okay. Mango has high potassium. But the amount and quantity used and how often really matters. That's why we tell them to take, if necessary, take a quarter to half a slice mango once a week. Oranges have high potassium, but not very high. So it depends how often. If you really require orange because of vitamin C for absorption of iron, do at least 1 or 2 oranges in a week. Do not go overboard, okay? Apart from that, grapes, roughly 6 grapes, but it depends. The red grapes are good for inflamming.
Careful, so you have to count.
Yes, around just 6 pieces or 7 pieces once a week, not often. They will really help you. Now, apart from, we have talked of vegetables.
What about, there is this other thing people always, I'm not sure how to pronounce it.
Thornmelon or pomegranate.
Yes. Yes.
It is fine, but the potassium levels are a bit higher, similar to the thorn melon that people take and say it's good for pressure. So why do we say it's good for pressure? Because of the high potassium levels that will balance your fluids. Okay. But at this moment, we don't really need it. Okay. Pomegranate really help in tending to control the fluid levels, remove all toxins, and also prevent inflammation of your kidneys. So a little bit, maybe half of it once or twice in a month will be okay. Similar to
not,
yes, not day. Often. Similar to tomatoes are very good, but tomatoes are very high potassium levels. So what do we tell people with renal to do? Not one more than half or 1 tomato in their diet, but what do? They remove the outer skin because it's where the potassium concentration is high, and then either boil it in water so that there is leaches of that potassium. Do not use much of these commercial spices because of the chemical component in them. Milk also becomes a factor because milk has phosphorus, it has calcium, it has potassium. Like half a glass of milk has about 400, okay? So let's say a typical breakfast, we can do a cup of tea, 2 slices bread, okay? So a cup of tea will have like half a cup of milk because the rest is water. Of potassium, that will be roughly 400, okay?
Right.
A slice of bread has 70 grams or milligrams of potassium. So you can do 2 slices of them. And brown bread is good and healthy because why do we say brown bread is healthy? Is because the fiber content tend to reduce rate of energy. But for most of my patients who are have a renal issue, I tell them to avoid much of the brown because of the brown with high potassium and take much of the white. Okay? Right. Because a slice of white bread will have 40 milligrams of potassium, or brown will have 70. It's higher, twice higher. So you can do white bread, you can do oatmeal porridge instead of the brown one, or white porridge. If you have diabetes, there is no problem, because a starch is a starch. It only depends on the quantity and how much you have taken. The only difference between white and brown is the fiber content. Okay? So if you take a portion like a cup, it will not be able to raise your sugar much. It's always the same thing. So do more of the white, you do more oatmeal rather than the brown because there will be accumulation of potassium. But if in case your potassium levels are normal between the 3.5, 5.5 that we've said, for the 3 months, then you can do the brown porridge. So milk, check on low-fat milk or skimmed milk. Don't do more than 300 ml per day or half a liter per day of all milk component that you're taking. Avoid taking milk, how do I say it? The milk cream, or we say butter and all that, or other milk products which are fat in nature, because they will just tend to act as the solid fat. Then apart from that, water control is very much important. Now, water control depends much with your stage of your kidney, whereby at an early stage whereby we talk of acute kidney injury, you require a lot of water so that it wash the waste out, okay? That can be around, you can even take 2 liters or even 2.5, okay? But when you have reached a stage whereby it's chronic, you are not able to pass urine, normally we give you fluid depending on urine output. And that is about 500 ml plus your urine output if it is measured in a day. But in general, we tell our patient to go to take pure water about just a liter.
Right.
If you are able to pass urine more than, not more than 3 or 4 times in a day. But if you are able to pass urine like 6 times in a day, you can go to about up to 1.5 of total water you take.
Okay.
But if your urine output is also very low, then take water only when you are thirsty or with your medication.
Right.
You can take cubes of water, ice cubes of water, and all that.
Okay.
And there's more to discuss as
Yes, because I'm being told we have a lot of questions coming in. And let's just start taking them. Let's take a look at some of those questions that are coming in. All right. I would like, this is Shoka. I would like to ask that my right kidney aches much more than the left, and the urine is green in color. What can I do?
In that moment, and that's why sometimes the doctor can also do an examination whereby they try to press either the left part of your abdomen to see if there is pain and all that. So she said the left kidney aches
more than the right.
The right one.
And then the urine is green.
It is green in color. Yes. In that moment, this person needs to go for medical checkup so that they will do now the kidney profile. They can do now the electrolytes and urea component that I've said. They check how is the kidney functioning at the moment, and the doctor will determine the management that they will do. So I will tend to advise the person, just go for checkup so that they know the stage where you are. Are you taking the right medication? What can be done? Are there other presenting factors? That will be the advice I can tell.
And also, you know, just take it easy. I know it can be a bit scary if that's what's happening. All right, let's take a look at the next question as well. What could be the cause of edema on my left feet, which is on and off, bearing in mind that I've done all the tests. I've done urinalysis, I've done FHC, I've done UECs, and they were negative.
In that component, if you have done all that, check, do you have a presenting condition like I've said? Do you have high blood pressure? Because high blood pressure can also lead to these effects. Do you have diabetes? How are your sugar levels? And if you don't have diabetes, you don't have high blood pressure, and you don't have any medical condition predisposing you to this, are using any medication that is affecting you. And if that is not there, then you can go, they get to determine what is leading to the edema in your system. So that is the only advice also that I can give to the person. So that they can give the person diuretics. Are you on diuretics to help to control this fluid, to remove this excess water within your system? Control salt at the moment. Control your water to not more than a liter, because too much water will lead to edema going more. Don't take salt for the moment until you watch your edema for some time. Don't sit more than, like, let's say 3 hours. Break it down, walk, because when you see there is a lot of accumulation of fluid also, allow blood circulation. That will also help in that.
All right, let's take a look at another question here that is coming in. I lost my baby, having a lot of questions. First of all, I'm very sorry for that. For a long time, I never saw my child passing urine. Did it mean that he had issues with the kidney?
There can be different problem. It doesn't really mean there is a issue with the kidney. It can be issue with the urinary tract. Maybe there was a blockage somehow that was preventing the child from passing urine. So I believe at that point, maybe we didn't really get to help the child at the time that it was required. But if the cause would have been determined early, maybe the child could have survived under medical care. If in any case it was something treatable, we really want to encourage you. You will get still many children, but it might not be really a problem with the kidney, because there are several issues that can affect the output of the urine even to a child.
Right.
Yes.
All right, once again, we are really sorry for your loss. All right, let's take a look at the next question here. Say, when I am urinating, the urine comes out like you think it is burning. What is the cause of this and what do I have to do?
So I don't know if the person has a problem in the kidneys, and if they have a problem in the kidneys, we've said one of the issues to know that your kidneys are healthy is passage of urine. And are you having presenting factors such as infection on of the kidney itself? And apart from that, are you using any medication? Okay? If you are above either 40 years, has your prostate been checked? Because the prostate also can affect your urine output. So I believe this is also in the terms, just get your review. Right. And that's why I advise people, review is important. Whenever you feel anything abnormal, do not assume it will be better the next day because you've been given medication. Symptoms present depending on the stage where you are. So anything, abnormalities that occur, the only thing that can determine is go for checkup.
All right, okay. Another question here. Hello, if somebody has high pressure and heavy weight too, can it cause kidney problems?
Yes, it can cause. Lifestyle factors such as Willis talked of alcohol. I think you told me about that.
Yes.
Alcohol has toxins in waste. And we said, how does the body remove waste? Through excessive fluid washing away through the kidney, through urination. So when every single day you expose your kidney to alcohol, toxins, and waste every now and then, you can have kidney issues. So when you have kidney issues, I would say do not even try. Avoid alcohol completely. Why did I say avoid cigarette? Because cigarettes tend to affect your muscles and nerves. Okay? They can clog them up. And once they clog due to the waste of the nicotine and all that, the filtration mechanism will be affected. So once you have kidney issues, there is no but. Avoid cigarette, avoid alcohol. Now, for the question that she has asked about, remind me?
She's asked that high blood pressure and weight.
Yes. So the weight can become a factor, and the weight can become a factor because once you're heavy, there is more fat deposition within your system. And as we said, fat can compose with different elements in your body to block these nephrons or the filters of the kidney. And apart from that, weight can affect your blood pressure. And with the high blood pressure, there is too much blood flowing in your system. This blood, because it needs to be filtrated, it will go also with that high blood pressure to your kidney nerves and overwork that pressure down there on your nephrons and affect your kidney function. So yes, high blood pressure, long term, uncontrolled. And this is, what do I mean by this? If you the higher pressure, the one on the top, we have the diastolic and systolic. The upper one is almost above 150, 140 most of the time. The lower one is mostly above 100 or 90 and above, or 100 and above most of the time. You have not checked on your lifestyle. You have not changed your medication with your doctors. Presenting factors as cholesterol and all that. Issues to do with your thyroid hormone. Hormonal factors or high blood pressure can easily worsen your kidney function. And that's why I said manage the presenting factors as a condition, either diabetes, hypertension, or any other factor. Then we cannot worsen your kidney issue.
All right.
Yes.
All right, well, we want to end it there because of time, and
yes.
Because we still had some more questions,
yes.
But now maybe you can tell them where they can reach you,
yes.
Find you, so that you can answer or they can
yes.
get some help.
So you can find me at Mater Hospital, and I'm not alone. We deal with different medical personnel in our renal unit. And our renal unit, we do dialysis, and this is on Monday to Friday. We do dialysis to our patient. We have a renal physician, we have renal nurses, we have a renal nutritionist, and for nutritionists now we have a body composition machine that also tends to note the water within your cells and outside of the cells that can present to you, because when there is no edema, the doctor can't determine if you're likely to have edema or water composition. Nice. So this machine will help you earlier to know if you have higher chances of getting edema. It will tend to show you if your levels of protein have started breaking that up to prevent that. And we'll give you a diet whereby we have told of protein, and then things like plant protein, the legumes, beans, dengue, you also soak them overnight. That is something I forgot to say. But apart from that, you can find me at Mata, and we'll give you a comprehensive note, because the time could not allow us to say this. We'll advise you to see our renal physician, whereby when you have these symptoms and these questions, they can be able to be addressed. If your kidneys are not well taken care of, they can be changed your medication or procedure. Kindly come there anytime. But one thing I wanted to say, witness, because I know we have a few minutes.
Yes, we have
Royal Media Service, 1 minute. Royal Media Services have always been supporting the community.
Yes.
And one of the ways is through partnering with Mata by calling me here to give information to the public. We have also supported our children with heart condition over the years, and I want to thank Royal Media's management and the leadership for that. I don't know why you have not supported this year, but you should,
right.
because you should make a change to the community. We have Heart Run coming this year, 6th of June, that will happen over the counties, Nairobi County, not 6th of June, 3rd of June. Nairobi County, Mombasa, Kisumu. We had gone to the ground to lay out the ground. This Thursday, Friday, Saturday, and Sunday, we'll be at Kisii County in partnership with KAA to examine children with that condition. So that those are Kisii through Royal Media Services, because we are reaching them to change their health, and Mata Hostel, they come there, we'll screen them freely, and those children will get there, will take for surgeries. So everyone support Mata Heart Run. Citizen TV and Royal Media support Mata Heart Run. So we do surgeries for these children. Otherwise, I thank you so much. Your health is your wealth. Kindly take care of your health. Come, we monitor you for Wellman's Person's Clinic or Well Woman's Person's Clinic, and we'll be able to assist you and make your health stable. Thank you so much.
All right. All right. Well, we'd like to thank you also for watching and for your questions. Unfortunately, we could not get to all of them, but he's told you how you can get to him. So make sure you do ask for Felix at Mata as well. I'd like to say thank you. We'll end it there. We'll see you tomorrow. And Nganga, Chelsea umetoka. Pole sana. Peace and love.